So what does it mean to have vein disease? Hi, I'm Dr. Sheen. I'm a vein aesthetics and functional physician in St. Louis, Missouri. So what does it mean? Well, vein disease is actually just a term referring to a condition called chronic venous insufficiency. And all it means basically is that people typically will have varicose veins, spider veins, things of that nature. Now, what is the significance of that? Well, you have to understand what vein issue or what varicose veins and spider veins actually are. And in reality is, vein disease, varicose veins and spider veins are actually sort of the same thing. They're just in a different part of your vein structure. So the spider veins are closer to the skin. Varicose veins originate from deeper within the leg. But the mechanism for both is essentially the same. So if you understand how veins normally work, okay, veins are designed to do one thing, and that's push blood in one direction. So effectively, they're pushing blood back towards your heart. Okay, so your heart will pump blood out to the skin. Your veins will take it back to the heart. But in order to do that, your veins actually have to fight gravity. Okay, because it's going up against gravity. And in order to do that, these veins all have what they call little, almost like casing valves or one-way valves built in that allow blood to be pushed only in one direction. And so basically, the muscles within your legs are the equivalent of that heart on the artery side, where as the muscles contract, they push the blood up, the valves open, they close, and then they incrementally push that blood up your leg back towards your heart. That's how your vein structure works, whether it be a varicose vein, a spider vein, doesn't matter. It's just sort of the work in that mechanism. Now, when people have vein issues, and again, for most people, it's sort of an inherited trait, those veins or those valves in certain veins become faulty over time. So as they break down, you can imagine gravity will take effect. Blood will start to pool down in your legs because most people are standing or sitting. And as a result, what happens is as that blood pools, it generates pressure, and that pressure starts to build. And eventually, as it builds, veins will start to dilate. They get bigger. They start holding more blood in there. And as a result, you start to see the spider vein. You start to see the varicose vein. And as a result, over time you start to accumulate more and more of this, and eventually it becomes to some degree some level of circulation defect within the legs. That's why people ultimately will start to develop symptoms from like itching, burning, aching, throbbing, soreness. They get leg cramps at nighttime, they get restless leg, things of that nature. So that in a nutshell is what vein disease actually is.